All right. Well, we will get started. Thank you, everybody, for your patience as the phones dialed. We dialed quite a few veterans today and are very happy to have so many of you sticking with us. Good afternoon and welcome to our telephone town hall. My name is Abe Rabinowitz. I'm the Associate Director of the hospital, and I'll be moderating the call. And we're very fortunate to have a panel of Madison VA's leadership team here to answer questions, including our hospital director, Christine Kleckner, our Chief of Mental Health, Dr. Tim Jurgens, our patient advocate, Chad Casey, our Associate Director for Patient Care Services, Teresa Edgren, our Chief Patient Administration Service, Liana Torres, our Chief of Primary Care, Rochelle Carlson, our Deputy Chief of Primary Care, Randy Carter, our Caregiver Support Program Manager, Jennifer Penton-Mackey, Whole Health Team Coordinator, Sarah Rogers, and our Public Affairs team, and our Acting Assistant Director, Stephanie Schilling. So we have quite a panel here to provide you with information and updates and also to answer your questions. We hope that as many of you as possible stay on the line with us this afternoon, and we encourage you to participate in the question and answer session that will follow. If you'd like to ask a question, all you have to do is press 0 on your phone at any point during the call, and you'll be connected with a staff person who will take your question and get you into the queue to speak with our panel. The Q&A session will be toward the end of our call, but you can press 0 to get into the queue at any time. So if you do get cut off, unfortunately, there's not an easy way to rejoin. So please stay on the line to stay with us for all of the updates in the Q&A session. We always like to start these teletown halls with a message from our hospital director. Christine, the floor is yours.
Thank you, Abe. And thanks to all of you for joining us on this call today. Before I share updates, I want to acknowledge that this week marks VA's National Salute to Veteran Patients, which we observe annually the week of Valentine's Day to express honor and appreciation to hospitalized and outpatient veterans. More than 9 million veterans of the U.S. Armed Forces are cared for in VA medical centers, outpatient clinics, domiciliary sites, and community living centers. And on behalf of the Madison VA Hospital and Clinics, we want you to know how much we appreciate you, your service to our country, and giving us the opportunity to provide your health care. And as we salute veteran patients this week, it is an exciting time for all of us here at the Madison VA to share updates on our progress with 2 major projects that will expand access to care and availability of services to veterans. First, we are planning the activation of a brand new community outpatient clinic in Baraboo that will double the size of our existing clinic to 10,000 square feet. Our new Baraboo clinic, located at 414 State Road 136, next to Anytime Fitness and just down the street from our old clinic. We will add a primary care team, expand the space for physical therapy and telehealth space, and add podiatry nail care to our list of services, as well as expand conference room and administrative space so we can better serve you. The target date for activation of the new clinic is May 2024, so look for updates for the formal transition of services to our new site of care. Also, we continue to make progress on activation of a brand new East Clinic in the summer of 2024. The new East Clinic will be over 30,000 square feet in size and include a multitude of services, including primary and mental health care, physical therapy, additional specialty services, podiatry nail care, telehealth, wellness, and whole health, and women's health services. The East Clinic will supplement services at our West Clinic and significantly expand access to care to veterans on the east side of Madison. Letters to affected patients will be going out soon with information about how to change providers or locations, if you choose to do so. We are so excited to be able to bring these new resources into service and look forward to providing you with additional details as we approach those activation dates. Please be on the lookout for additional information on both of these activations, particularly if you currently get your care at the Baraboo or West clinics, and if you know veterans who may not currently get their care with VA, please encourage them to check out our new offerings and their eligibility for care. It is our honor to serve veterans, and we always want the numbers who choose VA care to grow. Today, we have a few program updates for you. First, we have Jennifer Penton Mackey joining us to talk about the Caregiver Support Program. Second, Sarah Rogers joins us to talk about our whole health programs and how a health coach might impact your overall health. And third, we have Jim Bove to update us on events we will be hosting in the coming months. In between the presentations, we will have some poll questions for you, and we will make sure to allot time for your questions. I want to wish you all a safe and healthy remainder of winter. Stay warm out there, and please let us know how we can help you. Thanks, Abe. Now back to you.
All right. Thank you, Director Kleckner. We appreciate those updates. Next, I'd like to introduce Jennifer Penton Mackey, our Caregiver Support Program Manager, to provide an update on our Caregiver Support Program and services. Jenny.
Hello, my name is Jennifer Penton Mackey, and I am the Caregiver Support Program Manager at the Madison VA. Our mission is to promote the health and well-being of family caregivers who care for you, our nation's veterans, through education, resources, support, and services. We know what a critical role family and friends play in helping to keep our veterans healthy, and we are here to support them in that role. Even if you don't have a caregiver right now, you may find these resources helpful in the future for you or another veteran who may need them. Under the Caregiver Support Program umbrella, there are two parts: the Program of Comprehensive Assistance for Family Caregivers and the Program of General Caregiver Support Services. These programs have different eligibility criteria and some varying resources, but we hope that there is something that may benefit you and your caregiver. For the first program that I mentioned, the Program of Comprehensive Assistance for Family Caregivers, veterans must be at least 70% service-connected and require hands-on assistance with at least one activity of daily living, for example, bathing, dressing, or toileting. Or veterans may require supervision, instruction, or protection to remain safe in their home on a daily basis. The application for this program can be found at www.caregiver.va.gov. That website again is www.caregiver.va.gov. To learn more, or if you need help applying, reach out to us at 608-256-1901, extension 11576. That number again is 608-256-1901, extension 11576, and we'd be happy to help. If eligible, caregivers receive a monthly tax-free stipend, access to telemental health services, legal and financial resources, education and support, connection to other caregivers, and regular case management with quarterly wellness contacts. Our second program, the Program of General Caregiver Support Services, is really the heart of our program. And the best part is that any caregiver of any enrolled veteran can make use of these services. We have an amazing range of resources for caregivers, including skills training that can boost confidence as a caregiver, support groups with other caregivers, peer support mentoring, as well as access to a personal wellness coach for support in reaching meaningful goals. We also have some more basic services such as email updates and free encouraging text messages that require very little time, as we know caregivers are busy. Thank you so much for listening in today and learning more about what our caregiver support team has to offer you and your family. Please consider visiting our website at www.caregiver.va.gov for more information, or reach out by phone at extension 11576, and we would be so happy to talk with you more and get you and your caregiver the support you need. That web address one last time is www.caregiver.va.gov, and the phone extension is 11576. Thank you.
All right. Thank you very much, Jenny, for that update. Before we get to our next presenter, we'd like to ask a few polling questions. So when we ask polling questions, we'll ask a question and you can respond to the question by pressing the associated number on your phone. And we'd like to learn a little bit more about who out there on the call is currently using caregiver support programs. So our question is, please let us know if you currently use our caregiver support programs and services. Press 1 if you are a current user or a caregiver is a current user of our caregiver support programs, and press 2 if you are not currently using caregiver support services. Again, if you are a current user of our caregiver support programs, please press 1, and if you are not currently using our caregiver support program services, please press 2. All right, we are seeing a lot of answers coming through, and it seems like the majority of you are not currently using those services, so that is good for us to know. I'm glad we were able to give you an update on that. Our second question is a follow-up question, which is asking, after listening to our call today, rate your level of interest in learning more about our caregiver program and services. Press 1 if you are very interested in learning more. Press 2 if you do not believe this program applies to you, and press 3 if you're not interested in caregiver support services. So again, 1 if you are very interested in learning more, 2 if you do not believe the program applies to you, and 3 if you're not interested in caregiver support programs. Okay, so we have a nice balance of answers here. Thank you all for responding. And for those of you who responded that yes, you are interested in learning more, we're glad we were able to give you this update today and encourage you again to visit our website at www.caregiver.va.gov. That's www.caregiver.va.gov. Or for more information, reach out by phone by dialing our main hospital number 608-256-1901, extension 11576. Again, that's 608-256-1901, extension 11576. And we'd be happy to talk with you more and get you and your caregiver the support that you need. Next up, we have Sarah Rogers here to talk about our whole health programs and introduce you to the innovative and refreshing approach we take to care that we offer to our veterans. Sarah.
Good afternoon. My name is Sarah Rogers, and I am the Whole Health System Coordinator at the Madison VA. I would like to take a few minutes to tell you about Health and Wellness Coaching, which is a service available to all veterans at the Madison VA. Whole Health is the VA's approach to care that seeks to support and partner with veterans in living their healthiest, fullest lives. Health and wellness coaches are an important part of this system. Health and wellness coaching focuses on what is important to each person while helping them to become happier and healthier. Health coaches are trained to actively listen, explore what matters most, and partner with veterans to make positive changes in their lives. Veterans who work with health coaches often focus on eating well, being more active, managing stress, or spending more time doing things that bring meaning and joy into their lives. Health coaches do not diagnose or treat any conditions, and their role is not to give advice or tell you what to do. They listen, support, and help you sustain lasting change. If you are interested in trying something new as you move toward a healthier future, consider health coaching as a powerful tool, which is free and available to all veterans. Call us at 608-256-1901, extension 12537, and ask to get connected with a health and wellness coach. Once again, that number is 608-256-1901, extension 12537. We look forward to being a part of your team on your wellness journey. I would like to pause and ask those of you on the line to respond to the following question using the keypad on your phone. Have you heard or seen information about whole health during your care at the VA? Press 1 if your response is, this is the first time I've heard about it. Press 2 if your response is, I have heard about whole health before. 3 if your response is, I know about whole health and I am getting whole health care that supports my wellness and goals. Once again, press 1 if your response is, this is the first time I've heard about whole health. Press 2 if your response is, I've heard about whole health before. And press 3 if your response is, I know about whole health and I am getting whole health care that supports my wellness and goals. Thank you for your responses. It looks like about 65% of you are hearing about whole health for the first time. 28% of you have heard about whole health before, and about 7% are getting care that aligns with those wellness goals and is whole health care. At the VA, you may notice us starting to ask what matters most in your life, or we may talk to you about self-care and integrated health approaches like meditation or Tai Chi. These conversations do not replace standard care or treatment. They enhance it by putting your values first and supporting your wellness journey. I'd like to pause to ask another question that you can answer using the keypad on your phone. How do you prefer to learn about whole health? Press 1 if your answer is directly from my healthcare team. Press 2 if your answer is at my own pace from handouts, educational resources, and websites. Press 3 if your answer is I don't need any additional information about whole health. Once again, press 1 if you prefer to hear more directly from your healthcare team. Press 2 if you prefer to learn about whole health at your own pace from handouts, educational resources, and websites. And press 3 if you don't feel like you need any additional information on whole health. Thank you for your responses. It looks like about 40% of responses say that they would like to learn more from their healthcare team. About 42% would like to learn at their own pace from handouts and educational materials. And about 20% don't feel they need any additional information. Thank you for your attention this afternoon.
Well, thank you very much, Sarah, and it is really encouraging to hear that such a large percentage are interested in hearing more about whole health. So for those of you that answered that you'd like to explore it on your own or to get a consult, we want to remind you to take Sarah's advice and call. That number again is 608-256-1901, and the extension is 12537. And before we go into questions and answers, we have a few events coming up that we're excited to promote to all of you. So we have Jim Bove, our Chief of Public Affairs, who will tell us about a few of them. Jim.
Thanks, Abe. We do have a few exciting events we want to share with everyone. As many of you have seen, our Hall of Heroes is located on the first floor of our hospital. We induct new members twice a year, once in May, right around Memorial Day, and again in November, which is usually around Veterans Day. To be considered for our next Hall of Heroes ceremony in May, we must receive applications or nominations by March 1st, so that's just about 2 weeks left to get those in. The selection process is competitive, but we welcome any new applications that meet the following criteria. The veteran must have served in conflict or wartime. They must have received military awards for valor and or specific combat actions. They currently are eligible for care at the Madison VA Hospital and Clinics or would have been, and they have demonstrated a connection to local VA and the local community. For more information on our Hall of Heroes, visit the Madison VA Hall of Heroes website or call 608-256-1901, extension 19059. All of that information that I just went through is on the website. And those resources, again, it's the Madison VA Hall of Heroes website, or call our main number, 608-256-1901, extension 19059. And speaking of our Hall of Heroes, segue, a new documentary is out about one of our past inductees, Captain Scott Alwyn. We are honored to offer a free screening for the public, and that's scheduled Friday, March 22nd at 4 p.m. in the hospital auditorium. The film lasts approximately an hour, and then we'll have questions and answers with the producer and Captain Alwyn's sisters. The documentary is called Honor in the Air, and we invite you, your friends, and family to join us for a free screening on Friday, March 22nd, 4 p.m. in the auditorium. It's very well done. I got to screen it. I'm a little biased, but I thought they did a very good job. And last, we have celebrated the last several St. Patrick's Days with a visit from the Trinity Irish Dancers. The dancers range from 4 years old to 18, and it's always inspiring to see them perform their craft and carry on traditional Irish dance. They'll be performing live in the hospital auditorium Friday, March 15th at 11:30. The entire show lasts about 30 minutes, and you'll leave with Irish spirit and hopefully Irish luck. That's Friday, March 15th at 11:30 for the Irish Trinity Dancers.
All right. Thanks, Jim. Definitely a lot of exciting things going on. If you're in and around the hospital, please join us for the documentary, for the performance, and do consider if you have a veteran who you think would be a good candidate for our Hall of Heroes to look into an application. We're always looking for more candidates. And now it is time to move on to our question and answer session. So we have several questions in the queue. The first question we have is from Russell. Russell, you have a question about another clinic opening. Russell, are you on the air? Okay, not hearing Russell. Russell had a quick question about whether or not there's a plan to open a clinic in Oconomowoc. And I'll turn it to Stephanie if you have information on that.
Hi, this is Stephanie Schilling. I'm the acting assistant director for the month. And while Oconomowoc is a clinic that is opening for the VA, it is not under the Madison umbrella. It is under the Milwaukee umbrella. And so unfortunately, we don't know their for sure timelines or when they're specifically going to open, but I do know that last year in May, so May of 2023, they did break ground, so they are working on it. So I would anticipate that the Oconomowoc clinic should be opening within the year, I would guess.
All right. Thanks, Stephanie. And, of course, we have less information on everything that's going on in Milwaukee than we do at Madison, but thank you very much for that question. The next question we have is from David. David, if you are with us, please ask your question.
Yeah, just a second. I didn't quite, it kind of broke down. Was this for David?
Yes, for David. Go ahead.
Okay. Yes. The reason I had asked the question is that because of in my military time, I had some injuries to my neck and my back. So I've had chiropractic treatment goes on for years and years. And, of course, the VA has stepped in the last 3 years or 4 years and helped me with that. And everything was been going good. When I put a request in, my doctor would consider it and look forward it, and it would be approved, and everything was fine. And I try not to abuse the system. But for the last year and a half, it's gotten really complicated. I guess something to do with have a chiropractor in the Madison market, and I'm about over an hour away from there. But anyway, the chiropractor I have, I've been using for the last 2 years. It's amazing. He does extremely good work. He's very honest, very straightforward, accomplishes a lot. But every time we put in a request, it gets stuck in the system. And we start getting things, well, you got to go to the one in Madison. Then they say, well, you don't have to go, you're farther away. But it takes, sometimes I'm on the phone for like an hour or more different times trying to get it approved. And I was wondering if that system is going to be improved to the point where, like before, that as long as I'm being honest about everything, that I just put in a request and either it's approved within a few days or rejected, not that it should be rejected, instead of so it gets lost in the system every time. And then we got to go round and round and round and get it approved, and usually not quite what I wanted, but at least I get something.
Hi, David. This is Stephanie Schilling again as the assistant or acting assistant director. In my previous job that I normally do, I'm also the chief of social work. And so we've helped coordinate some services for veterans, and I can tell you that the experiences that you've had recently about coordinating care and community care should be improving soon because we have increased our staffing out there. We went through a period of time where we had some vacancies, and so things were taking quite a bit longer than we had hoped for to get organized in terms of the review process and having employees know what the qualifications and the guidelines for. So I appreciate the fact that you're sticking with us and that you're willing to continue to work with us while you get your care coordinated. And I do anticipate that those coordination efforts will improve as we become fully staffed and have the employees to do the coordinating work.
Okay, well, that would be wonderful, and I probably be needing some care coming into April or so, and I'll make a request to my primary doctor there, and we'll see how it works. If it works out well. If it doesn't, do I just call community care and talk to them and get them to get somebody to talk to me about it? Okay.
And then you can also call our patient advocate office as well, and we can all try to help coordinate your care and get the services in a timely fashion.
Okay, well, appreciate the answer. Thank you very much.
Thank you.
Thank you, David. And again, thank you for your patience, and we look forward to coordinating your services and improving the service that we provide moving forward. Let's see, our next question is from Donald from Waupun. Donald, if you're on the line, please share your question.
Yes, I presently carry insurance from my previous job. It costs about $200 some a month. Sometimes I wonder, do I need to keep doing that, or could I depend entirely on the VA for that?
Hi, Donald. You get me again. It's Stephanie Schilling. This time I'm going to put on my social worker hat for you, and I'm going to ask that you reach out to the social work office, and I'm going to give you that phone number.
Okay.
It's 608.
Just 1 second here.
Yep. Let me know when you're ready.
Okay, 608
256
256
1901 extension 17085.
Okay.
So that's
okay,
the
I got
office. And what
okay.
we can help you do is look at your situation, because it's not really a yes or no answer for everyone. And what we would want to do is to not tell you what to do, but help you consider all of your options through your private insurance, through the post office, if you're eligible for Medicare, if you're eligible for medical assistance. And then, of course, we'd love to have you to switch over to the VA, but only if it makes sense for you. And that's a personal, individualized decision, and we really need to probably know a little bit more about your situation to be able to give you all of your options. And
okay,
so,
thank you.
If you call us, we can get you hooked up with a social worker who knows a lot more about it than I do.
Okay, thank you very much.
Yep, thank you.
Thank you, sir, for your question, and also for considering using us for all of your care. That's our job, and that's why we're here. Let's see, our next caller is Richard. Richard, you have a question about travel.
Yes, I do. Travel pay, I know there's a lot of veterans that get travel pay, and I am one of them. I think the system of the website is hard to navigate, and I would like to see it either shortened up, or if there's somebody there that could. I presume this is a federal run. It was set up federally or whatever. I'm not sure, but or if it's a statewide, I don't know. But you have to sign in twice. As a matter of, once you're signed in, you have to re-sign in and stuff to get travel pay. And there's a lot of, I think, going through the different there's different sites to get travel pay. And I'd like to see if you could, in some way, shorten it up and make it a little easier.
Hey, Richard, my name is Kent Hall. I'm the Associate Chief of Patient Administration, and I appreciate your question. So for the travel pay, we do understand there is constant changes to try to make it a little bit better, but the best advice that we do have for anyone who has difficulties navigating the system is either trying to give our travel office a call. We do have a phone number, and if you're ready to copy it down, it is 608-256-1901, extension 11919. Additionally, if you have access to My Healthy Vet, which if you file your travel pay, you should, you can actually send a message to the beneficiary travel group for Madison, and we can actually return PDF instructions to be able to file your travel on a computer as well as your personal device.
Okay. The only thing I missed was could you give me that extension number again? I missed that.
Yep. The extension is 11919.
Okay.
And
all
Richard,
right,
to your question, the system that we're using is a national system. So we don't have a lot of choice in what gets used, but what we can do is really try to work with all of the veterans that use the system to make it as easy as it can be. So we know with any of these transitions that there are complications. So as Kent responded, we're here to help you or any other veterans that are having difficulty with travel pay, and that number and that 11919 extension is there specifically to help veterans through those processes. So thank you for the question. The next caller we have is Gordon. Gordon, you have a question.
Good afternoon. I am hoping that you can give me some insight as to what the status is on getting additional providers in the Madison area for community care massage therapy. I know there's a huge amount of demand, and it's very difficult when when a new provider is available to get in before they end up closing their intake of new VA patients because there's so many of us.
Hi, Gordon. My name is Rochelle Carlson, and I'm the chief of our primary care service. Here in Madison, actually at our West Clinic, we do have acupuncture and chiropractic service, but we do not have massage services. So most of the massage services are going through our community care. And I know that the community care service is working as best as they can to find more providers. And as Stephanie mentioned earlier, we are working through with more staff now so that we can respond to some of those requests in a more timely way. So that is the update that we have for today.
Okay.
And thank you very much for your question, Gordon. Next up, we have Tom, and we had a presentation on caregiver support, and Tom has a question about caregivers. So, Tom, please proceed with your question.
Yes, I'm in West Bend, and I'm wondering if the caregiver position thing is that a free Corvette, or is there like a co-pay to pay on that, or because I'm getting up in my years and I may need some help now and then. And I'm in West Bend, so I have to travel to Beaver Dam sometimes, and I have to get somebody to drive me there. So to stay in my condo and function on a day-to-day basis, I was wondering, is this a free service offered by the VA?
Hi, Tom. This is Jenny Penton-Mackey, the Caregiver Support Program Manager. So to be a part of the caregiver program, there are no co-pays for our caregivers. it sounds like you might be looking more for having a caregiver that's maybe not a friend or family member come in to take care of you at home.
Well, yeah, 'cause I've kind of exhausted my daughter and my brother, and yeah.
So the VA does have other programs that we can connect you with a more formal support at home. There may or may not be co-pays for that program, but that just kind of depends on your specific situation. So for you, I would recommend that you contact your primary care social worker. And again, I can give you that main number for the social work office if you're ready.
Okay.
608
Yeah.
256
Yeah.
1901, and the extension is 17085. And your primary care social worker will be able to talk with you just about all of the options and connect you to what might be most helpful.
Okay, so this is not a yes or no question then, right?
Right. So, yeah, that's true. It's not. But the caregiver program specifically, if you have a family caregiver that's enrolled with us, there's no co-pays for this program. But sounds like you've got a more unique situation.
Not really. It's just that I'm wondering, the caregiver position, is that a free service to vets? Otherwise, I'm on Medicare and then I got to pay co-pays for folks that have to come and check me out and do this and that, So that is my question. It's kind of like a yes or no.
Yeah, so the caregiver program is if you have a family member or a friend who's already providing the care who wants to apply or enroll with us, and these services are free.
All right, thank you.
Thanks for your question, Tom, and thanks, Jenny, for the answer. The next question we have, and we talked earlier about the East Clinic, was about the East Clinic, so very timely. We were just trying to navigate to the question now. Sorry. Hold on one second, folks. We're almost there. And the next one we have is from Jerome. And Jerome, you have a question about the East Clinic, which is a really important question for veterans who are at our West Clinic right now. So go ahead with your question.
Yes, this is Jerome. When I was listening to it, they mentioned that we'd be notified. It appeared like it was just the people that are going to the Madison area. Is everyone that is being served in the VA Madison area, such as I go to Beaver Dam, will I be also notified?
Hi, Jerome. My name is Rochelle, and I am the chief of our primary care service. That is a very good question. So our veterans who currently are at the West Clinic will be receiving a letter specifically about that transition. However, it's good to know that you're at the Beaver Dam Clinic and are interested in the East Side. And we can certainly, what I recommend is that you contact your primary care team and let them know that you would like to make that transition once it's open. We will then make note of that, and as we have more information on the opening, we can transition you to a new provider.
Okay, that would, hopefully it'll be done quickly, because we don't want to be left out of the system just because I live in Sun Prairie, which is much easier to go to the east side than drive to Beaver Dam. So, and they're very limited, of course, on the care that they can give there.
Right, and we're very, go ahead with your question.
I just have a couple other suggestions. One is, I recently was upgraded in my disability, and I was not sent any information as to the different care that I could get without having copay, etc. I'm little by little finding out some of the things that are available without the copay, including drugs, etc. So, as a suggestion, if people that are like myself that are upgraded, some type of literature could be compiled to send out so that we know exactly what other things are available to us.
Hi, Jerome. Hi, Jerome.
Okay.
This is Liana. I am the Chief of the Patient Administration Services, and we manage the health and benefits services. If you would like to give us a call, can you write down the number?
Yes.
It's the main number, 608-256-1901, and the extension, it's 17038, 608-256-1901, extension 17038, and then that is the line for the eligibility group. They can talk to you about your priority group and about what copays, if any, do you have, and answer your questions.
Okay, very good. Thank you. I have one more before we go. I'm currently, you're probably jealous, I'm in Florida. It's 83 degrees today. But I've got some questions on being able to use the VA facilities. I was told that they have a beautiful facility in Cape Coral, Florida, but because my primary care is in Beaver Dam, that I can't use that facility. Is there some place that I can call to get the upgrade as to what's available for me down here?
Hi, this is Rochelle, the Chief of Primary Care again. So when our veterans travel, as you do, we have a service called the Traveling Veteran Coordinator. And so any of our veterans that might require services while they're traveling, like lab draws or something like that, can access care by contacting our Traveling Veteran Coordinator. And then from there, we will coordinate the care so that you can have that care done where you are traveling there in Florida. The number for that we are looking up right now, and we'll get you so that you can access that number.
So, Rochelle, if you need emergency care, you can just go into and get emergency care, right?
Yes, if you need emergency care, you can just go to, you should just be seen at the closest facility.
That I did get some information on that, and they told me I could get urgent care at CVS. I drove over to the address they gave me, and it was at CVS drugstore. It wasn't really what I was looking for.
Oh.
We're sorry for that, sir. That's something that we can't obviously control here in Madison, but it's certainly feedback that we can take. But go ahead, Rochelle.
I was going to say another service we have is our telephone triage line, and so you can always call that telephone triage line if you're experiencing any symptoms. And we actually have providers now that might be able to treat a condition over the phone or with a video visit if it's a condition that can be treated that way, or further guide you on where it is best for you to go. So that would be another option if it's more of an urgent type of condition.
And that nurse line for anyone on the call is, again, our main number, 608-256-1901. The extension is 17066. And we also had a question about the Traveling Veteran Care Coordinator and the extension for that position. That extension is 18551. So again, you can always dial our main number and just ask for one of these. resources, and our operators will connect you. And our main number, again, is 608-256-1901. And our traveling coordinator number is 18551. Next, we have a question from Dick in Beaver Dam. Dick, go ahead with your question.
I didn't have a question. I just wanted to thank everybody at the Beaver Dam Clinic and the Madison VA. I get treated very, very well, and I just want to say thank you, and please let the Beaver Dam VA know how well they do.
Well, we certainly appreciate that, sir. Thank you very much for that compliment. It's our pleasure to serve you. The next question we have is from Gary. Gary, you have a question about dental care.
Yes.
Go ahead, sir.
Yeah, I was just wondering if there is or going to be any dental care for guys that don't have any dental coverage and nothing from their military service.
Hi, Gary. This is Stephanie Schilling. I'm going to put on my social work hat for you, and I'm going to say that the disclaimer is that, of course, we would hope that we could offer dental services to everyone, but those are laws that are established and eligibility requirements that are determined by legislators and folks out in Washington. So it's not a local decision that we can necessarily change. But what I wanted to let you know is that outside of the VA, there might be programs that are available to help you with your dental care if you aren't able to afford it yourself. And so I'm going to give you the social work office phone number so that you can call and talk to social work about affordable dental options. And that number is 608-256-1901, extension 17085. So we get a lot of veterans that are frustrated that they can't get their dental care, but we are sometimes able to find them resources in their local community at affordable prices. So please give us a call. Thank you.
Thank you.
Thank you for your question, Gary. Our next question is from Ed in Reedsburg. Ed, you're on the line.
Hello.
Go ahead, sir. We can hear you.
Oh, okay. My question is this, on the new hospital that they're putting in Baraboo, are they going to be able to take x-rays there? I'm 50 miles out of Madison, and I got to run all the way down to Madison for a 5-minute x-ray, and then, of course, come back, which is, I got to get a driver to take me down and bring me back, and I don't know, it seems to me an x-ray machine would, with that new hospital that they're putting up, they should have an x-ray machine there.
Hi, Ed. My name is Rochelle, and I'm the chief of our primary care service. And unfortunately, our Baraboo clinic will not have an x-ray machine. We are really looking forward to opening that clinic. We'll have some nice space, but we'll be focusing on primary care, and x-rays will still be available in Madison.
Okay. It's just a long trip.
Sorry, Ed. I know it would be nice for all of us to have everything that we need as close as possible, and we're doing all we can to expand access to veterans, but that particular service just isn't in the clinic plan because we can't put everything in the clinic, even though we're making it twice as big. So thank you for the call. The next question we have is from George in Wanakee. George, go ahead with your question.
Yes, first of all, I wanted to make sure that I thank all of you on the staff there that are putting on this town hall. They've been extremely helpful, and continue doing it, please. Also, I go to the West Clinic or the main VA, and I am constantly impressed with the service that get when we go in and we're taken care of so politely and efficiently and courteously. It just impresses me every time I have to deal with it. That's what I wanted to say first of all. Am I still there?
Yeah, you're still here. We enjoy hearing you say all of that.
Okay, I just don't stop having these things. I have a suggestion actually. When we do go out and about to either the store or wherever we go to, we run across people on the side of the road that have a sign up and they say, I'm a veteran, and they're just looking for some money or whatever. And I'm not opposed to that. I'm just saying, is it possible for the Madison VA to set up like a hotline and a business, make out a business card that us veterans can carry with us, that we can pick up 5 or 6 of these cards, and then we run across somebody, we can maybe give them their $5 or whatever we happen to have with us, but also give them a hotline number to call so that when you answer that line, you're going to be talking to somebody who doesn't know anything about getting help in any way, shape, or form, so that they don't have to go to the main phone number at the hospital, the 1901 number, and then go through a plethora of possibilities, but one person who will pick up that hotline and be ready to have a one-on-one conversation with this person that's on the street. And during the winter, it's kind of tough for them to be out there, and in the summer, I'm sure it is too. But I'd just like to ask for a possibility of a card for us veterans to be able to carry so we can hand them to them so they can get the care that they deserve. Every time I hear about veterans committing suicide, I think we need to find a way to get in touch with them.
George, thank you so much for your question, and thank you very much for thinking about your fellow veterans who are on the street. We're doing everything we can to outreach to those folks and make them aware of the very many VA services that are available for homeless veterans. But the idea of a card, I don't know if that's something we've thought about before. Stephanie, I'm not sure if you know.
Hi, George. I can pass that information along to my homeless program coordinator. They do quite a bit of outreach to the various areas, and I'm sure they have business cards in different areas and at different agencies that help the homeless. But I think that's a really great idea to have something that anybody could hand out, including myself when I'm driving home and see those same people that you're seeing. I also wanted to just let you know what the 1-800 number is, which is a 24-hour-a-day, 7-day-a-week, answered by a person, a trained person. So you'll get a live person. It's free. It's confidential. And so that number that veterans who are experiencing homelessness or going to be experiencing homelessness could call is 1-877-424-3838.
Okay, I guess what I'm saying is, for the outreach point of view, is all the veterans in the Madison area or anywhere within the Madison VA reach could be helpful in getting that outreach going better, so that more veterans are taken care of instead of left.
Great idea.
Yeah.
Thank you.
And George, to your point, we would always encourage any veteran who sees a veteran that wants help to refer them to the VA generally, because we do have trained people here who are actively looking for people who are homeless or who are at risk of homelessness to provide them with services. We are running to the end of our hour here. There was one last question about our clinic activations and whether they'll expand access to veterans, and I think that's the exact intent of those activations, is to expand not only logical access but also availability of care for veterans in our greater region. So we didn't get to that question, but we wanted to address it. We're really excited about the upcoming activations. We hope you are too. We really want to thank all of you for joining us on the call today. We know not everybody could stay on for the full hour, but for those almost 350 of you who did, thank you very much for your time. Thank you for trusting us with your care, and have a wonderful day. We will talk to you at our next teletown hall in about 3 months. Thanks, everybody.